Almost 25% of women experience a pelvic floor dysfunction, making it feel like their life revolves around going to the restroom. Here to talk about it a little bit more with its symptoms and treatments is nurse Christina Ferris. So hi, good morning.
Hi, good morning. I've been waiting for girls to have this conversation.
Right.
So
I'm the girl watch.
Yeah, that's right.
All right, so first off, can you guys kind of tell us a little bit what is pelvic floor dysfunction?
So it's a type of pelvic pain. So oftentimes when we hear about pelvic pain, we kind of think of menstrual cramps, but it's a lot more than that. It could be endometriosis, it could be fibroids, pelvic inflammatory disease, diverticulosis, irritable bowel, there's a lot. But today we're going to talk about pelvic floor dysfunction. So also when we're looking at the pelvis, there's lots of bones. You have the coccyx and sacrum. There's organs in there like the bladder and the uterus and prostate. And there's nerves and muscles and tendons. So what happens is they get weak. That the muscles and the tendons and ligaments that hold the pelvis together get weak, and that's what causes that pelvic floor dysfunction.
So what are the symptoms? Because, I mean, just the term is a little vague for some people, even though they're having the symptoms.
Right, absolutely. So oftentimes you're going to have pain, discomfort, kind of a fullness feeling. You might have difficulty controlling your bladder because those are muscles, you know, that control that, or bowels. And often it can be where things are stuck. So when you have a pelvic floor dysfunction, sometimes too it's that they're contracted and they don't relax.
Okay. And then is it treatable, or like kind of what could treatment potentially look like, or even just any relief?
Right, absolutely. So you can do medications. You can do things like hormone therapy, which can either be topical or inserted. There's pelvic floor therapy, and it's a type of physical therapy, but you need a special physical therapist who specializes in pelvic floor dysfunction. We do have them in the Rhinelander area. So you'd want to talk to your doctor. And 59 to 80% of people are treated that way. Now, it can be an invasive type of physical therapy, so it's something you kind of need to know. But oftentimes things you can do at home. You know, they'll teach you how to treat this. Now, there are surgeries. So some people will have problems with their bladders kind of falling, and the muscles just aren't holding them in place anymore. And so you might have to go in for a cystocele and some surgical procedures like that.
And then I know we kind of talked about symptoms, but how can you differentiate them, maybe like just plain menstrual cramps, or like, you know, common like girl issues versus this?
I think it kind of depends on where it's at. Typically these pelvic floor dysfunctions will happen with postmenopausal women. So women who are older. But anytime, this is why it's so important that you go in and get a physical. I know, you know, when you're younger, you realize, okay, I know I need to get a physical because I'm thinking about childbirth or having children. And those kind of things can also cause pelvic pain dysfunction. But when you're older, it's still really important that you go in, because unless we physically look at you, it's difficult to know what is going on, whether you have fibroids or you have adhesions or pelvic floor dysfunction, and these things can all be determined with a pelvic exam.
So best to check it out with your doctor.
Absolutely, absolutely.
Awesome. Well, thank you so much. We really appreciate you coming in today and bringing a little more awareness to that. And coming up, we have what's trending, including why